Can we actually talk about bariatric surgery? Because when we talk about maintaining weight or losing weight, obviously appetite's a huge part of this, whether how hungry we feel, how satiated we feel after meals or lack thereof. And of course, there's some surprising findings on actually what bariatric surgery does to appetite. Can you share a little bit of that?
Yeah, sure. So we have an emerging understanding that our weight set points. So if this individual weight that I mentioned before that our body tries to maintain, it thinks it is a healthy weight, even if it's obese. It thinks it wants to stay that way. If we lose weight, it's going to drag us back up there. And two factors will drag us back to our weight set points. One is our appetite and satiety, so our drive to eat or not eat, and that's hormonally driven. And the second one is our basal metabolism, so the amount of energy, even without getting out of bed, the amount of energy we burn off.
Mm-hmm.
And there's a lot of emerging evidence that, as far as the drives to eat and stop eating are concerned, that hormones from our stomach and our small intestine or guts actually have a profound effect on our behavior. And this is why the new types of bariatric surgery, the gastric bypass and the sleeve hysterectomy, where we remove or bypass the stomach, actually work. They have a profound effect on those hormones. So, for instance, I'll mention three hormones. The first is ghrelin, which is produced by the body and the top floppy part of the stomach. And this is a hormone that if we miss a couple of meals or we go fasting for a couple of days, will increase significantly in our bloodstream. It will go to our hypothalamus and it will stimulate voracious sort of drive to eat, food-seeking behavior, seeking out high-calorie foods. So ghrelin is very important to stop us, losing weight if we miss a couple of meals. Now, once we do a sleeve hysterectomy, where we actually remove part of the stomach where that hormone is secreted, the ghrelin levels drop significantly. So suddenly the patient sort of feels as if their appetite has just been switched off in the brain. They're losing weight seamlessly because their stomach is smaller. They can't eat as much, but they don't feel that, that rebound appetite that, is a real cause of dietary recidivism. The second two hormones that are affected in gastric bypass and bariatric surgery are satiety hormones. So they are called peptide YY, PYY, and glucagon-like peptide 1, so GLP-1. And both of these hormones are produced by the small bowel, and they're sort of like they're secreted when the small bowel senses food within it. So, i.e., the person's been eating, particularly protein, they're secreted next after sensing.